Here is a sample Clincheck video. So essentially what happens is you will send me a video of your cases and share it with me so I get the actual Clincheck. And I will go through the Clincheck as I'm talking here, as you see on the screen, and sort of give you answer to questions that you may have or give you advice or my tips on a case. So this is one of mine, and it's not a difficult case, relatively straightforward, but I asked them to move anterior teeth only. It was a little bit of relapse. And so let's have a look and sort of see what they did and what changes that I would make, which would be similar to the things that I would show you. So anterior movement only, there was a little bit of crowding. I'd taken off a wire on the bottom where there's a bit of a black triangle, which we'll address momentarily. And then there was a wire on the front two teeth, which allowed them to shift a little bit more forward. So ultimately my goal is to obviously align them better. And there's also some intrusion that's going on here. So I'm looking at the video from all different angles to see what issues can be improved or simplified. So the first thing that's a glaring thing to me is that there's a black triangle between the center of the front teeth, and they didn't address it. If anything, by the shifting of the tooth, they've actually made it worse. So that's something that we're going to have to address. I can also look at the overbite and the overjet, where originally it was 2.8 millimeters is 1.7. And then another thing that I typically do, which really is not as much of an issue over here, is check superimposition and see if there's any too much expanding or any other movements that are here. And then also I'll pull up the tooth movement table if there's anything significant, so I can see that the anterior teeth here, 1121, were intruded about 1.8 millimeters. So I want to make sure that I have the attachments that are there to support them. And they have these optimized deep attachments, not bad. Sometimes I'll put a secondary attachment, as you'll see. And on the bottom, they're actually done a little bit of extrusion of this lateral incisor as opposed to intruding the front two teeth, which I think probably could use a little bit of intrusion to level the edges, and then we'll need some attachments to support that. So once I've gone through the Clincheck and sort of determined what I would need to do for you, and this one's not bad because this is already set with my presets, but a lot of times when I get Clinchecks back from other doctors, then I find that there's a lot of changes or more changes that would need to be made, especially in some of them that could be the detriment of the patient if it's not planned correctly. So I clicked on modify, as you saw before, and so here I'm going to do some of the changes myself. So I don't like the black triangle here, so we're going to add some IPR. Now another thing that sometimes happens is they take this tooth and they did a little bit of crown angulation, 5.5 millimeters. So let's see what happens when I tip it the other way. Why did they turn it? It actually looks better this way, and now I have less of a black triangle in the center. And then when I look at the incisal edges, so this was tipped 1.6 degrees distal. Okay, so that's actually not bad. I'm going to leave that. And then I'm going to click on this tooth. I'm pressing shift, and you'll see that now I'm intruding. This is the intrusion button. I can intrude those a little bit more and just keep things out of the way. And now if I'm adding intrusion, I would want to change my attachments. So I'm going to put an optimized retention attachment. That's one option. Another option is I can put here for intrusion supporting. I don't mind these, so maybe I'll use this one. It's a rectangular attachment, but beveled to make it easier to take it in and out, but it still has the flat surface on the bottom, which will allow support for that anterior movement. So to me, that looks a little bit better. I have bite ramps on my anterior teeth. The truth is, I could use them on the central incisors because we want to prevent posterior open bites, but I don't necessarily need them on the laterals. Now, unfortunately, if I try to modify it myself and I pull it off, so what'll happen is I'll end up removing all of them. So I'm going to remove them, and I'm going to make a comment, place bite ramps on 1121 only. Now, ultimately, I can't do live update because now I've typed, but you'll be able to do live update. And the good thing when I do these videos for you, number one, you can watch them all the time and watch them back. But although I'm making the changes, the changes are not active in your account. So you have to follow along and do the changes simply enough of what I've shown you to do, assuming that you like it. And what that does, it allows you not just to, hey, that I've done it for you, you can actually learn from your cases. And I'll comment when things are going wrong or not the way that I expect that they should, and to get you a better Clincheck. Okay, so hopefully this is helpful, and looking forward to helping you on future cases that may come your way. All the best. Have a great day.